Welcome to What's Now, a show that is all about what's trending, new research, products, and much more. And this episode is specifically about your health and also about some resolutions in the digital space. First, we're going to focus on making sure that you don't skip those checkups, especially when it comes to cancer screenings. The pandemic has caused many adults to skip those, and you do not want that to happen. I recently spoke with a physician all about what you need to be doing right now, as well as a patient who is diagnosed and treated for cancer during the pandemic. This is followed up with a PSA all about making sure you get those screenings. Here's more.
An estimated 41% of U.S. adults delayed or avoided medical care during the pandemic, including routine cancer screening tests like mammograms and colonoscopies. Unfortunately, the rates of people getting these tests hasn't returned to where it should be. In fact, experts have predicted that delays in cancer screening tests will result in an excess of 10,000 deaths from breast and colorectal cancer alone. In addition, for people experiencing cancer during the last 2 years, the pandemic has caused either the patient or the clinic to delay treatment and heightened cancer patients' anxiety about getting sick from COVID during treatment. Here to talk about the importance of not delaying cancer treatment and routine cancer screening tests are Dr. Lisa Richardson, Director of the CDC's Division of Cancer Prevention and Control, along with April Donaldson, who was diagnosed and treated for cancer during the height of the pandemic. Dr. Richardson and April, thank you for being here today.
Well, thanks for having us.
Thank you for having us.
Dr. Richardson, how has the pandemic impacted cancer?
Well, the largest difference that we've noticed at the beginning of the pandemic was a large decrease in the number of people coming in to be screened. And that was because most facilities closed down completely. And patients were afraid and were canceling appointments as well. We've noticed an improvement, but it hasn't returned to baseline. And also there's a huge backlog of screening that has to get done for us to catch up. So we're doing this interview with you today to sort of get the word out about getting screened, getting back on schedule with the routine screening, and trying to avoid those 10,000 deaths that you mentioned earlier.
April, tell us how the pandemic impacted you and your treatment.
Well, for me, at times it felt like battling two monsters at the same time. And I didn't have the option to ignore one while I fought the other one. So I know that COVID is higher risk for people who have a low immune system, but cancer is just as deadly when it's left untreated. So I had to put aside any fears that I had to be here for my family and go through the treatment during the pandemic. And once I started going to appointments, a lot of those fears were relieved because the doctors and hospitals were taking so many extra precautions to keep patients safe. Not only were they masking and doing temperature checks, but they were going the extra mile in making sure that waiting areas weren't crowded and providing telehealth appointments when possible. So I quickly started to realize that I was at higher risk of catching COVID from going to get gas or getting groceries than I was going to my doctor's appointments.
Dr. Richardson, there are many important reasons to get cancer screenings, but for you, what is one essential point that you cite for getting these screenings? And define exactly what a cancer screening is.
So I'll start with the second part. A cancer screening is when we do a test, such as a mammogram, to look for breast cancer before you have symptoms. Because once you have symptoms and the cancer is large enough to feel or it's large enough to cause a problem, it's usually more advanced, which makes treatment a lot more difficult to do. And so that's, answer to your first question, that's why we, recommend screening for the 4 cancers that their screening tests are approved for, which is breast, colorectal, cervical cancer. This is Cervical Cancer Awareness Month, and lung cancer, because when we find it early, there's a better chance of curing the cancer and a chance that we could treat it and, as I just said, get rid of it forever.
And Dr. Richardson, if someone is going through cancer treatment now or has scheduled their routine mammogram or colonoscopy, is it safe for them to go to the hospital and clinic?
I think absolutely. Most cancer screening tests are done in the clinic, not the hospital. So it is safe, even in the hospital, associated, the screening facilities associated with the hospital, lots of procedures in place, which April mentioned earlier, social distancing in waiting rooms, people wearing, protective equipment like masks. So I think it's totally safe to go back in and want everyone to get back on schedule with their care, not just cancer screening, their overall medical, care as well.
April, what advice do you have for people who have just been diagnosed with cancer or maybe going through treatment right now?
Well, first of all, I just want to stress the importance of making sure that you get those regularly scheduled screenings. I actually had a normal mammogram in October of 2019. And then just 3 short months later, in February of 2020, I was diagnosed with stage 2 breast cancer with 3 lumps in my breast. So had I let COVID make me wait to get screened, I probably would not be sitting here today. So make sure that you listen to your body and don't ignore any symptoms that you may be having. Reach out to a healthcare provider and be your own advocate. Make sure you get vaccinated even while you're going through treatment. I myself have had both the flu vaccination and all of my COVID vaccinations. So when I actually did catch COVID this year, my symptoms were a lot less severe. And most importantly, make your health decisions based on facts and faith, not fear. And go to preventcancerinfections.org for lots of great tips and resources for staying safe while you go through treatment.
Dr. Richardson, anything else to add and anywhere else that we can go for more information?
Yeah, we have, some resources at CDC that have been developed by our division. It's cdc.gov/cancer, and there are several places there that you can find information on coronavirus. And we also have a link out to the main CDC site as well.
Well, thank you so much, both of you, for being here today. April, I really appreciate you sharing your experience with cancer, especially during the pandemic, how you dealt with the anxiety and also your encouragement to make sure that we get our screenings. And thank you, Dr. Richardson, for providing this important information to make sure everyone gets screened and does what they can do. So thanks for your time today.
Thank you.
In life, there are things that suck, but we do them anyway. Family meals with your wife's crazy Uncle Eddie suck, but we do it anyway. Because the memories that we make with family are everything. Family photo sessions with matching outfits suck, but we do it anyway. Because finding those photos years from now will make you laugh and cry. And you know what else really sucks? Getting screened for cancer, but not as much as letting things go undetected or untreated. So do it anyway. Screening can save your life from cancer, or even help prevent certain types of cancer, which will give you even more years of doing things that don't suck. For more information, visit getscreenedforcancer.org today.
Mammogram, colonoscopy, pap test. You need to go screen for cancer.